I'm Christopher Nolikin at Bulger Veterinary Hospital.
Hi, I'm Lindsay Benzulo.
Talking today about allergies in pets,
Spaying and neutering your pet.
pet weight management. And we're going to talk today about pet summer fun and safety. But doctor.
Mm-hmm.
She says, I got
You're good, good girl. You got a lot of
I'm a
treats.
good
A lot
girl.
of
I'm gonna
TD
jump
treats.
up on that table. Hi there, welcome back to Bulger Veterinary Hospital. I'm Dr. Christopher Nolikin.
I'm Dr. Lindsay Benzulo. We're glad to have you back to the podcast.
So today we're going to be talking about something that's been in the news, which is leptospirosis. So tell us about your research in the news report.
Well, I mean, it's been something that's been on people's minds because there have been a lot of local news stations that have been picking up a story about a lepto outbreak in the Boston area. And, it's something that has been around for a long time. It's not anything that's brand new. So leptospirosis is a type of bacterial infection that we have seen for years and years. But every now and then we do get little sort of spikes in the number of cases that we see. And it's quite potentially, very dangerous for dogs. It can be deadly or make them really, really sick. So it's understandable that a lot of news stations are sort of picking up on it. Yeah. So I thought what we could do today is we could sort of just inform the viewers about lepto, what it is, how your dog can get it or how you can maybe even get it, and ways in which we can prevent the disease from being transmitted.
Yeah, so, in looking at this up and tracking it down, it seems as though there was a little local outbreak that one veterinary hospital noted and had reported to the news. I don't know how widespread this particular outbreak truly is because we can't get that information very readily.
We were trying to find the numbers before we went on today to see if we could actually get actual hardcore numbers. We were having a hard time. We went to the CDC website and a few laboratory reference laboratories in the area to see if we could find an exact number. So we don't have any exact numbers to report to you, the audience, but it is something that we do see. I mean, even here at Bulger, we will see cases of lepto every year, right? Every year we see cases of lepto, and saying it's an outbreak versus is this sort of the normal amount of cases that we're seeing every year is somewhat hard to say.
Yeah, in some degree, it is hard, especially in veterinary medicine, to know the true prevalence of some of these things because a lot of the time it's a disease that people weren't looking for. So if you don't look for it, you're not going to diagnose it. You will only know if you have a positive if you actually test for it.
Right.
And so for a long time, I don't know that it was on people's radar, and now it may just be on more people's radar, and the testing's easier now.
Yeah,
so.
I mean, now we have sort of an in-house SNAP test, which is great, that can help out. And we also have other blood tests that you can send out to the lab.
We don't want to get ahead of ourselves.
We don't want to get ahead of ourselves
on
that.
We'll talk about the disease first.
But I think the reason why, Dr. Vernalikin had said it can be so hard to pick up and it's not in our minds is the clinical signs can sometimes be really vague, right? So you can see pets present in all different ways, but typically what ends up happening is if you've been exposed to the organism, or your pet's been exposed to the organism outside, we tend to see sort of vague clinical signs. So sometimes just fever, lethargy, vomiting, diarrhea, overall just what we call ADR or ain't doing right. So just kind of overall they're feeling kind of sick, which can be a lot of things, right? Those clinical signs are not just for lepto. It can be a lot of different things. So, and when you start doing some diagnostics and start doing some testing, you can start seeing some changes in the lab, in the regular sort of CBC and chemistry that you would normally do for blood work for these patients they don't always indicate leptospirosis either. I mean, they can be, other signs of, either kidney disease or liver disease. And so it can sometimes throw that to maybe not make us think about testing for that particular organism. Right.
Yeah. So the first thing is that when you bring your dog in for something like this, not feeling well or has a fever or vomiting, we don't always first immediately do blood work. A lot of the time we start with treating the symptoms that we see. Right. Next step after that, or if the dog looks very sick, would be blood work for sure. And that's how we're going to get an inkling of this. And it's really, it can be that dogs have this sort of classic liver and kidneys affected, which is just kind of a red flag for vets. But there are forms that will just be kidney disease. I had one case, actually the first case I ever diagnosed of lepto was only kidneys. Yep. And then there can be dogs that have just liver, and they can be, reasonably mild elevations in those values too. We do think that there are a lot of dogs that don't show those classic signs on blood work.
And you can. I mean, you can see, you know, based on, you know, each individual dog, like, you know, Chris is saying, you know, you can get dogs that are really, really sick, that can almost have this paracute, they can get so much lepto in their system and just it causes a massive systemic reaction. Those dogs can get really sick and die before we even have an idea of what's going on. And then you can get other dogs that have sort of a little bit more vague or mild clinical signs for a while. So yeah, I think the first thing is that realizing that sometimes it is sort of hard to diagnose. So the true prevalence can be really difficult in this particular area. But once they do come in and once we do have patients that are sick from it and that we actually have a diagnosis, then we can talk about different, you know, treatment options and ways that we sort of manage those cases. You know, it is one of those things where some of these pets, you know, can get really sick really fast and end up needing to be hospitalized for days at a time, just because they do feel so ill and their values are so bad. And after we get them over that illness, if we can get them over it, it can be sometimes long-term damage that had been done to their kidneys or liver. Yeah,
so one case that I had seen ended up needing dialysis.
Yep.
You know, and he's doing fine now, but that's certainly not a small or inexpensive proposition. I think what I looked at in terms of the mortality rates, it's around 10%. So it's not the most always uniformly fatal disease, but it certainly can be fatal. Yeah. I can also recall one that I had seen that had really mild elevations in the liver values, and it did have a positive lepto test, but that disease may have caused chronic liver disease that ended up taking the pet's life.
Yeah.
Or maybe that pet had something else. That's the thing. These are not just always single diseases that we know.
Right. Yeah. And so, you know, did we even really touch, Chris, on like what lepto really is?
Well,
I don't think we really went back
prevention,
to it.
I mean, we can talk about how dogs get it.
Yeah, I think that's probably, we should go back to that.
It's a bacterial disease, spirochete.
It's a spirochete,
which is a particular type of bacteria. And it's transmitted through outdoor water sources, typically fresh water. We're not talking about ocean water here.
And from the wildlife in particular.
From wildlife, yeah. So it's a deer or rats or perhaps woodchucks.
Yeah.
That might urinate into puddles, ponds, lakes, streams, even just your backyard, and it's particularly wet and rainy, or wetlands. We have a lot of that around here in Massachusetts, where your backyard is half wetland.
Yeah.
And that's where, so your dog goes out and drinks from puddles, as dogs do, and they get exposed to it.
Or even just sort of like sniffing, sort of that mucous membrane contact with.
You know, because they sniff and then they can lick their nose. They can get their tongue all the way up inside.
They sure can.
Nose. Yeah.
So, and I mean, it used to be something too that we used to think, okay, it's for only those dogs that
Hunting
are going out to the wetlands or out in the woods. And there's been a huge increase in the number of cases that we're seeing for, you know, these little city dogs or dogs that are sort of house-only dogs.
Central Park is a hotbed of leptospirosis, apparently.
Because you have all these rats that can carry the disease, and they're walking along city streets.
Are you saying New York has rats?
It does, just a bit, And Boston, and even Reading, actually. Reading is a little bit of Waltham. There's a few cities around here.
She's deteriorating a little bit here.
But the rat population, I mean, they carry it, and they go to the bathroom on concrete. So you're thinking you're walking your dog on asphalt or concrete. You're not going to be able to be picking up lepto, and that's not always the case. We're seeing a lot of dogs that, you know, people say they never touch the ground, and they end up getting lepto.
Incidentally, this is one of the big things that hikers are very aware of, that they should not be drinking water without treating it. So this is one of the reasons for that. So your dog is not always following those rules, not always drinking the filtered water.
Right.
And it's also been, you can find information about it in like the Hawaii Ironman. There were a bunch of people that got leptospirosis during some of that. Not recently. This is a while ago.
Okay.
In Hawaii, you'll see a lot of, all the streams have signs that say possible leptospirosis here.
Wow.
You know.
Wow.
Not all of them, I guess. I only went to like 3 streams when I was in Hawaii. But they did
Hawaii has got lepto.
Yeah. Well, every place.
Every place. I mean, it is. It's something where we see it a lot of times more in tropical areas, but Massachusetts is far from tropical. So we definitely see it in this area. It's honestly up like the Northeast, down in Texas.
Northeast, Southwest, and Midwest are the biggest prevalence.
Yeah. So you get it from these wildlife, right? So you get it from wildlife, from rivers, ponds, lakes, streams, but also just from that concrete. So wildlife carries it. These dogs go outside, they get, in contact with that infected urine or tissues or whatever, and then from there they get sick, and then that's when they come into us. And so figuring out whether or not your dog has lepto is a big first step, because like, we talked about earlier, it's not always on our mind. And so, treatment really, how do you treat these guys?
Antibiotics. You got to kill the bugs. So, the mainstay is obviously treating the primary disease, which is the bacteria. So getting rid of that. And it's actually a very broad spectrum kind of traditional antibiotic that we use, which is actually probably why a lot of these dogs may not get diagnosed, but they get treated appropriately, because that's kind of the first antibiotic. Amoxicillin or doxycycline are the ones that we grab for the not doing well, has a fever, and maybe people don't want to do a workup.
It's got something they were thinking is infectious.
We get lucky.
Yeah.
And then if for those really sick cases, we have often...
For the really sick cases, we need to admit them. We end up having to put them on IV fluid supplementation. Sometimes we have to help give them different routes of nutrition to make sure they're still able to sort of get food in them. IV antibiotics, IV anti-nausea medications, because they can really feel very ill. And we do have to be very careful of the patients that are in the hospital that are positive for lepto. Like we were talking about before, about Hawaii has lepto in their water. If you have a pet that has lepto, that pet is shedding the organism actively, like in their urine, in their secretions. So, we do, as a hospital, have to take very cautious preventative measures to make sure our staff remain safe. So we are disinfecting the areas outside. If they're going outside with appropriate disinfectants, we're making sure that we're wearing gloves at all times. So it is something that is zoonotic, which means is transmitted to people. And we have to be careful that we don't get lepto as well.
So if we think your dog might have lepto, we will advise that you be cautious around urine, although it is said that once you start treatment with antibiotics, it basically clears that potential. We're just very cautious here in the hospital because we do have patients near each other, and we're in very close contact with those pets.
Right.
But usually by the time your pet goes home, it's pretty safe. You still shouldn't, just don't drink any pee. Please.
Wash your hands.
Wash your hands.
It's always a good thing.
Don't eat poop and don't drink pee are my two mainstays of safety for owners.
My parasitologist said that in vet school. I said, a lot of problems would be avoided if people and animals just didn't eat poop. That's true. Yeah, just wash your hands. So wash your hands.
So, and then prevention.
Yeah.
So we have a vaccine.
So, there are a lot of different types of lepto, right? So if you actually go to look into it, there's lots of different serovars of it. But we do have a vaccine that is pretty good. It's not 100% effective because there are so many different types of serovars, but it is a really good way to help prevent your pet from getting lepto.
Do you vaccinate? I'm going to embarrass you.
I do.
Yeah,
do you?
Me too. Yeah.
And I feel as though it's one of those things where... I think a long time ago, there was sort of rumors, maybe this vaccine is so reactive, it causes more adverse reactions in these patients. I really
don't see that anymore.
I just don't see that. So I do think it's great to vaccinate. I now recommend, or I have been recommending, all my puppies get that vaccine because I feel as though all the patients that come in as young puppies, if we can get them on a vaccine protocol with lepto, I think is a good idea. So it should be something that pets in this area get just because they can get really sick from it.
This is one that I see a lot of breeder documents that are advising clients not to get this one. And, a lot of it is based upon that old kind of rumor mill thing. And yes, this vaccine did, so you may be too young to remember this, but, 20 years ago, this vaccine was potentially more reactive. But vaccine technology changes, and they get better and better and better and less reactive. I have not ever seen a lepto vaccine reaction. I have seen rabies vaccine reactions and others, but not lepto. So.
Yeah, and theoretically, any vaccine has the potential of causing a reaction in any dog. But I just feel as though the risk outweighs the benefit, outweighs the risk. So I feel as though getting that vaccine, getting that on board, I think it outweighs the risk.
We're just going to have Lindsay log in here.
Let me get in here. Hang on one second.
A question, I guess. So yeah, and then the other thing to be aware of is that when vets are advising vaccines, we're going to tell you what we recommend, but every vet's going to have a little different communication style and is going to push harder or less hard. No vet wants to be the one who pushed you so hard to get a vaccine that you finally caved and got it, and then you have a reaction. So we will make our advice and we will tell you what we suggest, but then if you say you don't want to do it, we're going to go with that. But we are making that recommendation for a reason.
I don't see it. Is this not?
Do wildlife carry leptospirosis without becoming ill?
Yeah, there are carriers. So an animal can get. So the question is, can wildlife carry the disease without getting ill? So they probably do get ill for the first week, but then they remain a carrier unless you treated them all with antibiotics. Yeah, which we don't.
And the same thing about cats. Cats is interesting because cats rarely get leptospirosis, but there have been some reports that maybe they do carry it as well. Like in shelter situations, they were saying that they were testing some of these cats, but they don't really get sick the way that dogs get sick.
At least visibly sick that
we can tell.
That you can detect.
Yeah.
One other, it's more of a statement. Their breeder advises against it because it's such a small breed.
Oh, there was a question about the breeder advises against the lepto because they're such a small breed. I mean, that's a great question. This goes along the fact of a lot of breeders, sometimes they come out with even recommendations that the actual vaccine vial that we're giving, the mil of the vaccine, is too much vaccine for the small breed dog, or how much the dog weighs. We don't agree with. I don't agree with it. It's not, as far as looking at immunology, it's not correct. So it's totally fine to do this vaccine in small breed dogs. I, for instance, have a 6-pound dog and I do lepto vaccine on.
And I have a 13-pound dog, although she has gained a little bit of weight.
Yeah,
but
Lola might be like 7 pounds chunky, or 8 now.
But small breed dogs, they still need vaccines, and they still need the same vaccine dose, and they're perhaps just as much, if not more. All of these dogs that are getting it in the cities, they're all little dogs, and
the couple of patients that I had last year that had it, I had 2 patients that had lepto. Both of them were smaller dogs that ended up, they actually both died from the disease. They were positive lepto. Yep. We tried treating, we tried everything we could, but those patients did die from it. So the little guys, I mean, not that it's reported anywhere or I know any studies. I just feel like anecdotally when the little guys get it,
sicker.
They get really sick.
Yeah.
So I feel as though I find the vaccine for them is really important.
Yeah, the 2 dogs that I have treated recently, one was a Chihuahua. That one needed dialysis. Yep. And the other one was a little terrier. She was only like 10 pounds, and she's the one that died of liver disease associated with it. Yeah. So, So, and, my advice just is that, breeders out there, we would love to work with you on these things. We really want to talk about what recommendations you're giving to people, and I think it would be better for all of us if we had that kind of an open relationship and open-mindedness on both sides, so Definitely. That we can help you to make the right recommendations. And we can take care of the medical recommendations for sure, and look up all the current research on all of these things and try to help you with that.
Right, because I think that a lot of the times the recommendations that are being given by the breeders are not done of a place of harm. They don't want your dog to get lepto and get sick and die. They are concerned for whatever reason they may have, but maybe it's just not the right thing. And so we can help provide, studies and data and to show that, we feel comfortable vaccinating your pet and that it will be, beneficial for them.
When do you start the vaccine and how many boosters?
Okay, good.
Yeah, so the question is, when do you start the vaccine and how many boosters?
Why is it not posting up? Hang on.
I don't know. She doesn't have the right post up. It's
I don't
fine.
think I have it.
So we usually start the vaccine at any time after 12 weeks of age, and it's 2 boosters. So once, and then 2 to 4 weeks later, and then it's just an annual vaccine. It does not last as long as some of the other viral diseases that we are vaccinating for, that sometimes we'll say it lasts 3 years or longer, but the lepto really is just a once a year kind of thing.
Yeah.
That's fine.
Sorry. I was trying to find it for you.
So that's leptospirosis. You could definitely keep asking questions on there, as we go, and we can continue to answer them later. So to switch gears a little bit, the other topic that I thought you would love is to talk a little bit about eyes.
I do love eyes. I mean, ophthalmology, I think, is something where not everybody enjoys eye disease.
I do not enjoy.
And that can be vets. A lot of vets don't enjoy eye disease.
It's not because I'm squeamish, I'll tell you that much.
Yeah. Some people just don't like it.
I think, my big concern, and I think the concern of a lot of people, is that no animal, eyes are not a vital organ that without which you can't sustain life. But they are very emotionally important to us as owners, right? You look into your dog's beautiful brown eyes, and that's how you make an emotional connection to them. So we're worried that things that we're going to do could really result in the treatment going badly because they seem like a very sensitive
right.
part of the body.
Right.
So, talking about just the different parts of the eye. So I was thinking we could kind of go into a little bit about the different parts of the eye and what can go wrong with those things, just kind of in a nutshell. So,
that's great.
I was going to start with the fun factoid that I love to give to kids when I go to kids groups is you can actually see a lot about what the animal's natural lifestyle is from the eye position. So I like to talk about this.
Let's hear it. I haven't heard this. This is brand new to me too. I like this. Well, what are you going to say? I want to hear it.
Eyes facing forward and overlapping significantly gives you very good acuity, right? So it makes gives your depth perception and 3D vision, and it allows you to know exactly where something is so you could pick it up, or like an owl can really find that prey from a far distance away. So most of the predator species have eyes in the front of their head. And so you think about dogs, cats, humans, a lot of the apes and everything all have their eyes facing forward so they can see things with great detail. Yep. And then you have the species like horses or rabbits that are prey species that they don't actually need to know exactly where the thing is. They just need to see that it's coming at them. And so they often have this great 360-degree peripheral vision, but they can't actually, some of them can't even see in front of their noses like rabbits. Yeah. Because they want to be able to see if something's coming at them and just bolt and run. And so a lot of the prey are that way. Yeah. I just like that.
I like that. That's a cool little fun fact for kids. I like that.
So eyelids, we do see issues with the eyelids. The purpose of the eyelids is to moisten the eyes, protect the eyes. Yeah.
Probably the most prevalent thing that people will see on eyelids, especially on dogs, is little eyelid masses.
The little masses, yeah.
A lot of dogs have them, especially as they get older. They're just sort of these little fleshy growths that can happen right on the eyelid, and they can get really, really big, and sometimes they can rupture. And those we call like meibomian gland adenomas, or they're just benign little eyelid masses. And for the most part, they don't cause any harm. They just look kind of gross to some people. Yeah,
they get icky a little bit.
And they can get really big, and they can infiltrate the eyelid margin itself, which isn't a good thing, or they can constantly rupture, and in which case people will end up, sort of opting to take them off and have them removed. Which
I usually advise people to take them off while they're small because it's way easier to take them off than we can do a freezing procedure as opposed to needing to actually remove a portion of the eyelid, which gets pretty involved and usually involves an ophthalmologist or maybe somebody like Lindsay with a lot of interest in it.
Yeah, I do. I love ophthalmology. Yeah.
Then there's the third eyelid, which is a nifty little structure.
It is.
Humans don't have this.
No, we don't. So that is the little thing that's in the corner there. And sometimes if your pet's not feeling well, sometimes it will like raise up. Or if they've got like a cut or an ulcer on the surface of their eye, they use that to kind of help protect against their eye too as well. So they'll sort of raise that up.
You can find it if you close your dog's eye and push back a little bit. Yeah. You can see it come up because it will always come up unless you don't want to do that, which I totally get.
But they do. They have that little third eyelid and probably there's a gland that's back there too that can pop up. And a lot of people know something called like cherry eye. Right. And it kind of looks, the reason why it's called that is because it sort of looks like a cherry, or it's sort of like a little red fleshy mass that's right on the, right on the middle part of, right in the medial aspect, right out here on the part of the eye.
It's obvious. It's not, don't go, if your dog doesn't have a big red thing bulging out, like you're not going to miss this.
And you see it most often in like brachycephalic or smushy faced dogs, right? So dogs that have the short nose, they end up getting cherry eye. Yeah. Not always. That's not always the classic, but it's just a lot more in brachycephalic breeds. So
those, if you did see that, usually we see it at a young age. So like puppies, they'll get one side, and then the other side will pop up because it is a genetic related thing. Yeah.
And we can fix that too.
They do need to be fixed because if you don't, they will just chronically be irritated and eventually get probably dry eye. Yeah, yeah. No one should ever cut them out. That was an old thing that vets used to do, just cut it off. Yeah. But that's an important gland producing tears. Yeah. So we don't want to do that.
So we can fix that too.
Yeah, fixable. Yeah. So then we have the dreaded red eyes. Yeah. Okay. Right. So perhaps conjunctivitis or other things.
Yeah, I mean, anytime you see sort of redness around the eye, it can mean a couple of different things. And so going to the vet, they'll be able to distinguish, is it something like, like just sort of a bacterial infection that's going on? There can be viral infections that can cause it too, but majority of the times it's a bacterial blepharitis or like sort of an infection of that tissue around there.
Blepharitis means eyelid inflammation.
Yes, there you go.
It's a fancy word.
You can get scratches on the eye that cause the eye to be a little bit red or corneal ulcerations and stuff. So, so red eye, is always something that you should go in and have it seen.
Yeah.
Sometimes you can just have simple, like, we think it might just be some allergies that are causing some irritations. But anytime that you have a red eye and you have a dog kind of squinting, those are signs that, okay, this is probably something we should get checked out sooner than later. Because squinting, even though people think, oh, they're not in pain, they're not crying, squinting
they are.
It's a dog's way of telling you, or a cat's way of telling you, this hurts.
If you just think about what would you have to be feeling for you to be closing your eye and not able to open it, that would be some discomfort.
Yeah, it definitely is uncomfortable. So that's something to get checked out for sure.
Yeah. Red eyes or squinting. So the cornea is kind of cool. Cornea is actually a 3-layer organ, right? You think it's just this clear thing. It has a thin single layer of skin on the outside and on the inside, and then inside is just this matrix material, but it's all clear. So it should always be clear. And anytime that it's not, that is something we for sure want to check out.
Right.
So if you see definitely a blue color to the eyes, whiteness, what else?
You can sometimes see red. I mean, sometimes you can see vessels
red,
moving in.
Yeah.
So but the cornea is the part of the eye that's the part of the tissue that's over the eye that's right over where your pupil is, so that black hole, and all that iris. So the color.
The color, yeah.
Those parts, that cornea lives right on top of there. So that's the area of the eye that we get worried about.
Should always be clear. Now, there may be things that we find that are chronic that we can't necessarily fix, but they do result in a change of color. There's some old age degeneration issues, and there's also some little deposits that they can get, or they can have corneal scars. But you want to establish that that's what it is before we say it's fine.
Yeah.
So then the iris, we don't see a ton of problems with the iris, the colored part.
I'm thinking about the most common things for owners. I think probably the most common thing with the iris that we can see is we have to watch, in kitties especially, any kind of pigmentation, like a freckle on the iris. Or, we see it a lot of times in cats where you can get an iris melanoma. You can see it in dogs too, but if you see a freckle on your cat's iris, your dog's iris, the color part of it, and it, if it's just something new that just came up, I'll be like, I took a picture.
Changing.
Yeah, I took a picture of my kitty, 6 months ago, and I didn't see that freckle, and now it's there, or it looks more 3-dimensional. Again, sometimes it can be hard to distinguish, like an iris melanoma, so having an ophthalmologist or having a veterinarian take a look at it is a good idea. But those are some of the changes that we can see on the iris. You can see normal changing or iris atrophy, which is sort of a normal aging change of the iris where it kind of just looks almost like disintegrating,
like a spider web.
Yeah,
kind of
that's a good way to describe it.
And then dogs get iris cysts, which are kind of cool because you can't tell as an owner that those are not a tumor, but they'll get these little cysts that originate from sort of behind the iris, and you'll see them flopping around, or sometimes they'll pop out in front of the iris.
They're like little tiny balls.
My Basset Hound had that.
Of colored pigment, and it just kind of jumps around. For the most part, those are not concerning. You can get very rarely. They can hop into the filtration angle and block it and cause a glaucoma, but it's very rare.
Right.
Very rare. Yeah.
So, and then moving back, we get a lot of questions about cataracts, and that'll be people that genuinely their dog has a cataract, or people that it's kind of an old age change and it's not really cataracts.
Right. Yeah, because we can get in the lens. So the lens is the part of the eye that's where the pupil is, that black part, the black hole that you see. The lens lives right behind there.
And that's what allows focusing on objects.
And that lens can get filled with proteins that kind of become white, or a cataract, right? So when you have cataracts in the eye, the dog cannot see. If it's a complete cataract or the whole entire lens, the dog can't see out. So there's nothing wrong with the eye itself. The eye is functional as far as all the nerve stuff in the back part, but as far as seeing, it can't see because now it's got a
because if you put something over any clear part of your eye, then they can't see through.
They can't see.
Right? Light needs to get through.
Yeah, so those cataracts, and you can get immature cataracts where there's just a couple of them that form. And I feel like a lot of people probably feel like they can relate with that because they may have had some cataracts. They have cataract surgery. They can start seeing, a couple of areas as they get older where they need to have it, have those cataracts removed so they can see better. Dogs can develop immature cataracts, and then it can become a mature cataract. And there are certain diseases that can cause, cataract formation in dogs in particular. Diabetes is a big one. A lot of diabetic dogs develop cataracts. But, there are some things that can look like cataracts that are not. Normal aging change of that lens is called lenticular or nuclear sclerosis, and it can make the eye look kind of white, like right where that would be, right where the cataract would be, but the dog can see just fine, because when we take a look with our little ophthalmoscope, we can see right into the lens, back into the retina, so we know it's okay.
Yeah, so and you'll see that at the age of 7 or 8 usually in dogs, and it's as you're looking at your dog, you might see like a little haziness.
Yeah.
Just when the light hits it just right.
Yeah.
And that's not something you need to surgically address. The cataracts can be removed.
Yeah.
And we've talked about that before, that's something that board certified ophthalmologists do. Especially in those diabetics, because they can have very complicated ones.
Yeah. I mean, what you just don't want is what ends up happening is you can get like a lens-induced uveitis, which is a fancy way of saying that because that stuff that's in there, it causes a lot of inflammation in the eye.
It leaks out of the lens, and the eye can really deteriorate from that. So.
Yeah, and I think one of the cool things about the eye is you can get this condition known as uveitis, which can be caused by a variety of different things. But sometimes if the dog is just not feeling well, if the dog has a systemic infection, sometimes lepto can cause it.
Right. Back to
lepto. You can get a lens-induced or a uveitis because of something else going on with the dog. So uveitis is painful eyes. They kind of like are half squinting their eyes.
Again, red and squinty.
Yeah, and they don't feel that great. They look like they kind of feel sick. And there's a lot of inflammation in the eye itself, but it's because of maybe something else going on somewhere in the body can cause inflammation all the way up in the eye. So anytime that we have a case of uveitis, we start looking about why are they having uveitis? What's going on? Is this something in the eye that's causing the uveitis, or is there something else systemic that's causing the uveitis?
I've seen Lyme do that.
Yeah, Lyme can do it too. Yeah.
So then there's a big bit of jelly in the back of there, which I don't think causes any problems that I'm aware of. I don't know anything about that jelly. It's called the vitreous. I know it exists.
Yes. Yeah.
But it's, again, a space that should be clear, and people get floaties. I don't think that dogs really get vitreous floaters that really cause any problems.
They don't cause any problems. You can get some, like, asteroid hylosis and stuff like that, or just not. They're very benign. Nothing that you need to worry about back there. Yeah.
I have a floaty right here.
Do you really?
Yeah.
Oh.
Whatever. The retina is the last little bit.
The retina is so important. The retina is what makes you, or makes your dog, or makes your cat be able to take those images and process it and go to your brain.
It's like a circuit board.
Yes.
For your eye.
Yes.
So it takes everything, processes it, sends it up into your brain via the optic nerve, and it's responsible for black and white vision and color vision. Dogs and cats, we know, we're often told they're colorblind. They're not, strictly speaking, completely colorblind, but they definitely have better night vision because a lot of them are evening or nighttime predators, and so they see much better at night, and that's why they generally have much better black and white vision than they have color vision. Yeah,
because back there they have these things called the rods and the cones help see color. And so, as humans, we've decided, or we've determined that we have more cones than...
We've determined this?
We have,
like evolution?
We have not determined. This would be scientists have determined that there are more cones in people than dogs and cats. So they just don't have as many, so their color range isn't sort of as extensive as ours.
And we do see retinal problems in dogs. We'll see retinal detachment due to, again, other systemic problems like high blood pressure. We'll see masses back there. Yep. Sometimes we'll see just retinal degeneration where the retina just gives up and stops working. So, yeah, I mean, that's the eyes. And we can have things that happen behind the eye occasionally. We'll have abscesses or masses that develop behind the eye that can cause the eye to look funny. Sometimes that third eyelid will be up. Sometimes the dog will be painful. Cats, too.
Yep.
Sometimes will be head shy and they won't want you touching near their eye. So really, I guess that, anytime you're worried about the eyes, you would want to come on in and we'll take a look, and we usually do a very limited number of tests.
Yep.
And just figure out what's going on.
And eye stuff is one of those things where sometimes it can progress a little bit quicker than people would feel comfortable with. So sometimes if you do have a dog that's kind of squinting and painful, getting it checked out sooner than later is always a good thing. If you notice it on a Monday and you can't get in the office until Friday,
that might not be great.
Might not be great because those days can sometimes matter. Eye disease can progress fairly quickly. So.
Yeah, and there are some conditions like glaucoma is a very prime example of that. You see your dog developing a big blue eye. Your dog has a better prognosis for vision if you get them in immediately. If you let it go as long as 24 hours,
it can be tough.
Your dog could be permanently blind. And blindness is not the end of the world. Dogs survive just fine as visually challenged.
Yeah.
They get around very well. They use their other senses. We can help them. They don't have to hunt for their food, but we would always prefer to preserve vision when we possibly can.
Yeah, I think that, blind dogs can live great lives. They really can. Our ophthalmologist always says that, and they really do. I just think that we always associate what we would feel, kind of project that on them. But a lot of dogs are just super happy to be eating and having you love on them. So,
but isn't it awesome when they have cataracts and then Dr. Marion
really
does her
awesome.
cataract surgery and all of a sudden they can see, like they actually act like
if you take a blind dog that's completely blind because of cataracts, and I think that's one of the best. I don't know, it's one of the
so
best.
Rewarding.
It is so rewarding. One of the best post-op procedures where they wake up and they really can see and they feel great. So it's good. That's eyeballs. I love eyeballs. I love ophthalmology. It's fantastic.
Yeah. So that's our show.
Well, we have these wonderful decorations thanks to our wonderful setup crew here for Halloween.
Our marketing team.
We're excited about Halloween. Halloween is coming up. If you go onto the Bulger Facebook page, we recently had a Halloween photo contest, which was super cute. If you haven't gone through the photo albums of that and taken a look at some of our patients that have submitted pictures, we did have a winner. Our winner is now going to be our cover photo for the entire month, right all the way up until Halloween, right? Till November, all the way through till November. So go take a look, check it out. They're super cute patients.
It's adorable, Ewok and Leia.
We have a big Star Wars
fan. They wanted me
here.
to not say, I'm a big Star Wars fan, and I will say I loved that. But I will say that we have a little bit of mixing of the Star Wars and the Return of the Jedi movies, which I'm sure the submission person was very well aware of. But it's so adorable. It's a little Ewok with
cute
Leia from original Star Wars.
There's a lot of effort to dress up. She came in. That was taken in the lobby, right? I think that picture was taken in the lobby, it looks very cute.
My daughter dressed up like Leia from that movie with the buns.
Oh, it's very cute. It's very, very cute. So take a look at that. And then, don't forget our sponsors, Ethos Veterinary Health, Bark of the Town, which is right on 114. And
they're grooming, and you can go to andovergrooming.com.
Very good.
To check them out.
Yeah.
Please don't forget to subscribe to our podcasts on iTunes and Google or wherever you get your podcasts. And if you rate us, then we go up in the rankings and people actually are able to find us. So that's great. And as long as you give us good ratings.
We want good ratings.
Good ratings.
And honestly, give us any feedback that you have. You can email us
Don't
or
say
write
that
us
our
on
voices
Facebook.
are annoying. We know. All right.
So that's this episode of the podcast. Thank you so much for joining us. We hope to see you next time.
That's a wrap.
That's a wrap. Thank you so much. See you next time.